Good morning, good morning, good morning, and welcome to Kaleida Health. Welcome to Kaleida Health. I'm sorry, welcome to the Great Lakes Health Radio program with Kaleida Health. I'm your host, Francesca Messiah, Manager of Workforce Development. We are always honored to be part of the WUFO Power 96.5 family, and we have been with the station, I would say, for over 10 years. You might ask, who is Kaleida Health, especially if this is your first time tuning in to the station. First, I'm going to begin with our mission statement. Kaleida Health's mission statement is advancing the health of our community. And that's what we're doing, attempting to do through the radio show, is to educate our listeners, our community about Kaleida Health. And who is Kaleida Health? We're hospitals. We are Buffalo General Medical Center. We're the Gates Vascular Institute. We're Rochide Children's Hospital. We're DeGraff Medical Park. We're Millard Fillmore Suburban. We are also non-hospital that provides provides services from the hospital. That's called the Visiting Nursing Association, the VNA. And that's our guest for today. We'll be speaking with the president of the VNA. Kaleida Health has clinics for adults, for children. We have clinics specifically for women and women who are women who are pregnant or want to get pregnant. We are also located in several of the Buffalo Public Schools with our school-based health centers. So that's who Kaleida is. We're in Buffalo. We're in Erie County. We're in the North Towns in the Williamsville area. We're also in Niagara County with DeGraff DeGraff Medical Association, as well as DeGraff Long-Term Care. We also have two long-term care centers. That's the one in Buffalo, that's High Point on Michigan, corner of Michigan and High Street, as well as the one I just mentioned, DeGraff. Also, Kaleida is hiring. Please visit our website, Google Kaleida Health. That's KALEIDAHEALTH, and type in careers. We have thousands of positions open, some in the hospitals, some in the labs. We have a huge laboratory system. Also at Visiting Nursing Association. And on that note, we're going to begin our interview for this morning with Lisa Greisler. Good morning, Lisa.
Good morning, Francesca. Thank you so much for having me on again. It's nice to be here.
Oh, it's great to have you on the program. And Lisa is a Senior Vice President for Home Care at the Visiting Nursing Association. And Visiting Nursing Association, let me not say who the Visiting Association is or what you do. So Lisa, your first two questions, please share a brief overview of the Visiting Nursing Association, often known as the VNA, and let's talk about the services that the VNA provides, and if anything has changed since the COVID pandemic and the services available.
Great. Well, thank you so much. So the VNA is the first home care agency of its kind in the country, founded in 1885 by Elizabeth Coe Marshall. She actually had the opportunity to receive care at home after she had an accident and felt that it was important for others to be able to receive the care. So that really started the whole home care movement across the country, which we're very proud to be the founder of that. So the VNA provides a wide range of services for people in their home. Many times patients are referred to us from the hospital after they've had a hospital stay, but just as often from their doctor's office after a doctor's visit where there might be a concern that their provider has about their needs to be cared for at home. So typically the types of services that we provide would be skilled nursing, and that might be anything from teaching someone about their diabetes, to medication management, to wound care, post-stroke, a whole variety of types of illnesses that we can help patients with. Physical therapy. Now, these days, you probably know that so many patients are able to receive a joint replacement, a knee or a hip replacement on either a same-day surgery or outpatient basis. And we provide therapy services the same day for patients after that type of surgery. So we do a lot of physical therapy for our joint replacement patients, as well as any number of conditions, Parkinson's, stroke, MS, and a variety of conditions, just difficulty walking. Occupational therapy helps a patient with, things like bathing and how to be more independent in dressing. We provide speech therapy, often from a result of a stroke or other neurological condition. Social worker to help support patients who are also having difficulty with perhaps with finances or linkage to other resources. We have a dietitian who also helps us, as well as aid services for some of our patients who may need some, just additional help in the home. I think the other thing that's really important about VNA, which I'm proud to report also, is we have a number of specialty services that we provide. And our services cover 10 counties of Western New York. One is we have our own infusion pharmacy. So we're able to provide IV antibiotics or total parenteral nutrition or other types of medications to patients. We compound them ourselves. We have our own delivery fleet that brings them right out to the patient's home. And then that type of medication is supported by our infusion therapy team. So our nurses who are specialized in infusion therapy and help our patients with how to manage an IV at home. We have a large team of nurses that do that. And we also take care of, as you mentioned, patients who are expecting. They may be a high-risk pregnancy, and also for pediatric patients. So someone who's had an infant and maybe there's some special concerns that might be taking place, or it might be as simple as helping them with lactation. And then also the other primary services that we have that are really specialized are behavioral health. So patients who are experiencing a mental health illness, or maybe they're having anxiety and depression over a chronic illness or something else that's happening in their home. And we also have a team of certified wound specialists, because many of our patients come to us with a wound, and we're very fortunate to have certified wound specialists who can provide the specialized care that's needed to help that wound heal. So that's a lot of information, but those are the services we've provided. We continue to provide those since the pandemic. Of course, we've taken care of patients, and we continue to. Although the numbers, thankfully, are fewer, patients who have COVID, we're certainly able to care for them in their home settings. And I think during the pandemic, that was something we were very happy to be able to do, to help people move out of the hospital and come back home where they're more comfortable and we could safely care for them at home.
Wow, that is quite a mouthful of services.
That's a lot.
You know what? Before we talk about the hiring and what positions are available, I just want to ask a little bit about wounds. At what point, if someone is living alone, or if someone is living with a family member or a friend, at what point should you be concerned about the wound? I think that's just an area that a lot of times, wounds, there's all kinds of products out there. There's Band-Aids, there's bandages. But at what point would you call visiting nursing associate or even your doctor? At what point is a wound need attention, from medical attention?
There's so many different types of wounds, but I would say, certain things like a pressure ulcer. So some family members are caring for a loved one who is in bed and they're not able to move a lot. So those people are at high risk for some sort of pressure ulcer. And that you want to make sure that you actually contact your physician right away, because those can be quite stubborn and can easily, deteriorate. But, I would say anything that is not healing within, a week, maybe, or starts to look very angry looking, or drainage that looks like there's maybe some infection going on, definitely talk to your doctor about that. We can get out and help with taking care of that. There's so many bugs out there, if you will, that you just don't want anything to take hold and make it more difficult. So I would say anything that doesn't look right to you, when you have a scrape, when you have a cut, how it should look, and it's starting to look better. But after a week, if it's not looking better, you really do want to make sure that you're not going to develop a complication or have some sort of infection that would require, more complex treatment. So we're used to dealing with a wide variety of wounds, but it's really important for people to keep an eye on their own body as well as that of their loved one, to see if there are things that look unusual. And if it's not, the thing is, we can always come out and assess. And if it, we take photos, send that to our wound specialist, they make a recommendation, and then we can get the right treatment going. And if it's not anything concerning, then, well, that's good news.
That is. And I want to also say, if there's any swelling, so if your foot keeps swelling, that's another reason for concern. Okay,
yep,
I just sorry, I just kind of diverted for a little bit.
That's quite all right.
Thank you. How about hiring? What positions are you hiring? Are you currently hiring, or maybe you're not currently hiring, but that there are some positions that have turnover because someone may move into another department?
Yep. So we're always looking for registered nurses. We also hire licensed practical nurses, or LPNs. The thing with us, which is a really nice kind of concept in home care, is we don't have walls around us, so we don't have a limited number of beds, if you will, like a hospital might, and know that we're full. But we know that there's a need in the community, really an ongoing need for home care services. And so we're always looking to hire registered nurses and LPNs in particular, as well as physical therapists and home health aides. We also, as you mentioned, thank you, VNAWNY.org. You'll be able to go on there and you can see the positions that we have open, and also the sign-on bonuses that we have, which are available to RNs and right now and new grads. That's
excellent. And I have to say that I remember when my mother had, when we used VNA services, it was because she had a difficult time walking.
Mm-hmm.
And I used to say, Mom, your personal trainer is coming. And it wasn't a personal trainer, it was a PT. But it worked. She really needed to work on her strength. And I saw firsthand, and also when Visiting Nursing Association comes to the home, and please tell me if I'm wrong, that they can, and if it is something exercise, they can work with their loved one and not have to wait till the next time the VNA comes out. Is that true?
Yeah, we would. So, certainly we would work with the patient, and, we try to make recommendations for the family or for the household, or, make modifications that would really be positive for the patient and the family as well.
Mm-hmm. Yes. Yeah. Thank you. What if the patient's primary language is not English?
Well, we do have a number of patients who where English is not their first language. So we have a number of options that we use. We are able to use some assistive devices that would allow us to use an interpreter over the phone. And there are a wide variety of languages that we are able to access, which is great. Sometimes we find that we need an in-person interpreter, and we make arrangements for that. So if we're trying to demonstrate, an IV, for example, it's much easier to have somebody present in the home where you can talk together with the interpreter present. So we do also use a number of patients who have that. And then, of course, things like deaf adult services and other types of resources in the community, we access those as well. So, that's not a barrier for us at all. We take care of patients from a number of different backgrounds and cultures, and where English is not their primary language, or maybe they're really not familiar with English at all. And we were able to work through and be able to take care of them at home.
That's great. No, that's great. Good to know. At what point will the patient receive a referral, or can they make a self-referral for services provided by the Visiting Nursing Association?
Yeah, most of our patients come to us from a referral from a hospital after a hospital stay, or from a visit to their doctor, or sometimes a call to their doctor. Sometimes people can't get out of the house very easily, and they call their doctor, and they might say, I have a sore on my leg. It's not healing. I don't know what to do, but I can't get in to see you. And the doctor may call us then and ask us to go out and do an evaluation, and then get back to the doctor on what our recommendations are. So people can self-refer. That's fine. We do require, a doctor, because we have to operate under doctor's orders. But if people don't have a provider, we're able to help them get set up with a provider as well. We have a number of resources that we work with through our affiliated physician groups that are very, very responsive, and they understand that how important it is, if a patient does need home care, that they work with us to make sure that we get a doctor assigned to them.
Mm-hmm. Oh, that's very nice. How about telehealth? Again, I've seen that done at home, where people will take their own blood pressure, their weight. Could you talk a little bit more about telehealth, and is telehealth for every service provided by the VNA, and when does someone need or use telehealth?
We don't provide any longer the typical telehealth that we have in the past, which was a device that was called Store and Forward, where the patient's vital signs were automatically sent to us. We did use that for quite a while, and it was a useful tool. But what we found over time is we wanted to spend more time on really teaching people how to self-manage. So we provide our patients with a scale. So everyone has a scale, and we teach them how to weigh themselves and to record their weight when it's a concern for their weight, for somebody with heart failure, for example. And then same thing with monitoring blood pressure or blood sugar. We want to make sure that they have the equipment that they need in the home, and we can help them get that if it's something that we don't provide. And then we will link, and then we'll work with them to learn how to use it and to report, to their provider or to us when there's variation. So I think those are some of the things we've learned over time. We do use, a telephonic visit. That's usually a part of our care plan. The day after a case is opened, the very first visit, we call to make sure things are going okay. Our next visit will be the following day. We want to make sure that there's no problems. So we do a lot via the telephone. And then also during the snowstorm, which nobody wants to talk about.
No one wants to talk about. Exactly.
We did use, we were able to, in an emergency situation, we were able to FaceTime with patients when they had a concern about a wound or something. We did some FaceTime with patients to help them out. And we're working on setting up additional video communications with our patients so that we have that ability to do a video more frequently, because sometimes it's just easier to take a look at what's going on rather than use other types of equipment.
Yes, because the reason I ask that also is because people are listening, maybe from from a radio in their home, but they may also be Googling, Googling this program, and they could be in Holland, New York. And I just want to make sure people feel secure knowing that the Visiting Nursing Association services. Matter of fact, let's talk about that. How many areas do you service in Western New York?
Yep. So we cover 10 counties, the typical 8 counties of Western New York, if you will. And then we're also in Steuben and Livingston County. And we do have a small office. We cover a small area down in Bradford, Pennsylvania as well. And and so those offices, so we don't have an office in every single branch, but we do have, for example, in Allegheny County, we have an office in Wellsville that covers Allegheny and Cattaraugus counties. And I think that the comforting thing there, Francesca, is that we hire from the community. Those nurses and therapists that are working in those different counties, that's where they live. So they have such a commitment to their community and to their friends and neighbors and loved ones that live there, that's who they're taking care of. Same thing here in Erie County. We're taking care of our friends and neighbors and loved ones. And so I think that's a comforting thing for people on the other end who are receiving services that can be kind of frightening to have to be dependent on someone coming in your home. But we're your neighbor, and we might be your relative, a cousin or something, but we're taking care of our community. I guess that's the comforting thing. We're part of the community.
Yes, and to say we're the first in the country to
exactly.
So we've been taking care of community, and as our mission statement says, advancing the health of our community for over 200 years.
Yes,
or nearly 200 years. How about blood work? If someone, because a lot of times, labs services are open between hours when someone who's living at home, when that person who's living at home with their family can't get out to the labs, which we have several Kaleida labs throughout Western New York. Does the VNA also draw blood? Can they come to your house and draw your blood?
If a patient is on service with us and they need blood draws, we will definitely do that. I would say we could do it for people who are not on service. It's just not covered by their insurance. So that would be, a potential cost to a patient. But sometimes we can work some things out with the lab for blood draws. But typically, if a patient is on service with us and they need blood draws done, we do that for them.
And speaking of health insurance, what type of health insurance does the VNA accept?
Yep. So we really do have contracts with the vast majority of providers locally, certainly Medicare, Independent Health and Highmark Blue Cross and all those different payers locally, as well as a number of others. There's too many to mention. What we do is when we do receive a referral and we gather that patient's insurance information so that we can, talk to the insurance company ahead of time. We can know if there's any copay or whatever that situation might be, so that the patient will know up front if there's any issues about coverage. But for most payers, home care is a covered benefit. Some have limitations on the number of visits. Others, like Medicare, certainly don't. There's just other types of rules that we need to follow. But for the vast majority of insurance plans, home care is a covered benefit.
Okay, thank you. Anything, we've covered a lot of topics. Is there anything, before I even ask that question, which is there anything else you'd like to say? Could you just say a few words on how important it is keeping the patient at home, keeping your loved one at home?
Yeah, I think that, we all want to be home, and we do better at home. People heal faster at home. They are able to use their own equipment. They are surrounded by their loved ones. They have their pets at home. They're in their own bed. all those things that you want. You feel more relaxed at home, and really helps your whole healing process to be able to be in your own environment. And it's less of less anxiety, less worry for you and for your family members. So being at home has shown to improve people's health. And we want to. Our goal is to keep people at home safely for as long as they possibly can. And for most people, that's their whole life, which is great. And we're glad to be able to do that.
Okay. And we just have a couple of minutes left, but anything you'd like to elaborate on or something new we haven't talked about?
Well, the only thing I would just say is it's certainly if people have any questions about the services or they're not sure if they need anything, they could always call us at 716-630-8000. We have nurses that work in our intake departments who are more than happy to answer any questions that people might have about home care or if they might need it. And as I mentioned before, sometimes people don't even really, know until we come into the home and we say, you know what, this looks concerning. Let us see if we can help you with something. So, if it's an assessment visit and there really is no need, there's no worry for the patient. There's no charge. We don't bill your insurance if it's something that we're not going to really do for you. We're just taking a look to see if we can help you. But again, if there is something that needs to be done, we want to work with your doctor or your healthcare provider to help you stay at home.
Mm-hmm. And I also want to say that in some cases, there may be nothing wrong. So
right.
at home, I mean, it might be what the service that you're asking for. So VNA is not coming into your home trying to see what's wrong.
Mm-mm.
They're just trying to help you through you or your loved one through the medical journey. And something else, I know we have like less than a minute left. What's the age range that you service?
We take care of, well, as I mentioned, before you're born. So maternity patients, but infants all the way up to hopefully somebody who's over 100 years old. So all age ranges. Mm-hmm.
And on that note, Lisa, I just want to thank you so much for being our guest. And also, you're also president of Home Healthcare.
So I am president. Yep. And I'm a registered nurse also.
Yeah. So anyone out there in nursing, there's nursing in the hospital, or there's nursing as VNA, as Lisa is, in her career, is the president of Home Healthcare. And her job is working with people who are in the community 24 hours a day, 7 days a week. Because we also didn't mention that visiting nursing services provided by Visiting Nursing Association are available 24 hours a day, 7 days a week.
Yeah,
correct?
That's correct. We're always here for our patients. If they have a problem in the middle of the night, they don't know what to do, a question, they can call and speak to a nurse. And if need be, we will send a nurse out. Sometimes that's what's needed in the middle of the night, something that we want to come out and take a look and see how we can help the patient. So we're always available to our patients 24/7.
Thank you. And I want to thank you, Lisa, for being our guest this morning on the Great Lakes Health radio program. And I want to say, listeners, don't touch that dial. We still have another half hour where we'll be hearing from the Near East and West Side Task Force on Passport to Wellness, taking place at the Broadway Market on December 1st, beginning at 9:30 in the morning. And now on to part 2. In case you weren't aware, besides working for Kaleida, I'm also executive director of the Near East and West Side Task Force, formerly known as the East Side Task Force. However, it's been supported by Kaleida Health for over 22 years. The Kaleida has supported the task force. And so today we're talking about what's called the Passport to Wellness at the Broadway Market. What's significant about it? We've been at the Broadway Market. The task force has been at the Broadway Market the first Friday in December in the morning for the past 10 years. And I appreciate everyone, all of our member organizations, and especially the participants who've come out to participate in that. Our guests for today are two of the board members of the Near East and West Side Task Force, and that's Dr. Lynn Rivers. Good morning, Lynn. How are you today?
Good morning, Fran. I'm terrific. Thanks for having us.
Oh, you're welcome. And Lynn is chair of the physical therapy department at UB. I'm sorry. She's chair of the physical therapy department at Juville College. And also, as I said, a board member of the Near East and West Side Task Force. And our second board member we have is Dior Lindsay. Good morning, Dior. How are you?
Good morning. I'm doing well. Thanks for asking.
Oh, you're welcome. Dior is program director and executive director of the Osborne Association. And I'll let her talk about a little bit about that. But you know what? Let's just jump right into Passport to Wellness. And Lynn, let's start with you. Why did News Task Force create Passport to Wellness, and how long has this taken place? And I just want to mention, I believe, Lynn, you have also been with the Near East and West Side Task Force, and before that, the East Side Task Force, correct?
That is correct. I have been a member for all 22 years and made most of the Passport to Wellness at the Broadway Market. So, yeah.
So why was it created?
Right. So what was fascinating to me as I was a member of the task force and we were running health fairs was that we'd have all these wonderful organizations with lots of wonderful information, and participants were racing through and skipping the few organizations that were doing essential health screenings. And so we brainstormed about how we could bring those essential preventative screening services to the community and have the members participate. So we conceptualized this idea of a passport that gets stamped, right? Everybody knows what a passport is. So we created a document that had a spot for a stamp, but in effect a signature, and incentivized with gift cards from Tops Market, or a gift card that would benefit them as a member. But they had to sign off on all of the key health screenings, and it became great fun that the participants enjoy having something to carry around and get those signatures, but they don't get the signature from the health screening if they don't do that screening. So that's how it became a Passport to Wellness. And it's been incredibly well received. And I've been so pleased and thankful of how many people we have picked up that have had high blood pressure or that have had something come up on a screening and immediately get referred to dental, back to a primary care or some other care provider.
Mm-hmm. And something that I didn't mention, where is a Passport to Wellness? Well, it takes place in the Broadway Market, and that's 999 Broadway Avenue, and it takes place across from the meat section. The meat section, and if you're in the back of the Broadway Market, there's a meat section. The other side is the back is seafood. We're back by the meat section, down the road from the seafood section. Just wanted to give people a visual. Dior, you have been a part of your organization. I'll let you tell us the name of the organization. How many years have you been a part of the task force and the task force, as well as a Passport to Wellness? And what does it mean to your organization to be part of Passport to Wellness?
Yeah, sure. So just quickly, a point of clarification. I only oversee Buffalo. We have 5 offices and our CEO is Archana.
Archana, sorry.
So I do want to give respect to a role that I am not in. I only Buffalo. But we have been a member of the Near East and West Side Task Force as an organization in Buffalo. Just our, Buffalo location, obviously, since 2019. And we've done Passport to Wellness every year since then, and it's been awesome. I think it's a really wonderful opportunity for us to get out in the community, share what we do and why that's important. And, also just during a really festive time. And it's just a really cool opportunity to see other folks in the community, what they're doing, and to really be visible and present. And yeah, I definitely love the Passport to Wellness initiative. I think, especially it being during the holiday season, I think it makes for perfect timing.
And Dior, at the end of the Passport, after the participants speak with everyone, one of the questions I ask them is, tell me one thing that you learned. Your organization, the Osborne, comes up, oh gosh, if I could say 9 times out of 10 times. So if you could tell me, what does your organization do that everyone remembers?
Yeah, so we at the Osborne Association in general, at all 5 of our offices, we support folks from arrest to reentry and children, youth, and family services. Specifically in Buffalo, we support children and families affected by a loved one's incarceration in Western New York. And oftentimes when folks come to our table, especially at Passport to Wellness, they say, I wish that this was something that was around when I was younger. And because our work really focuses on decreasing stigma and increasing resources and awareness and providing education, I think it really sticks out in terms of, that intersection between the criminal legal system and public health when we're focusing on supporting families. And I think because of that unique perspective, and the services that we offer, video visiting and youth support for this very particular issue, it really sticks out in a very, very unique way that I don't think folks are accustomed to. And we're the only folks that do it locally. And I think that really sets us apart when it comes to doing this work, when it comes to health and wellness.
Thank you. And Lynn, okay, so Passport to Wellness is taking place on December 1st, Friday, December 1st, at the Broadway Market, 999 Broadway, beginning at 8:45. We want to catch you as early as possible till 12:30, or it's until we run out of all of the passports. I should say, till we run out of all the gift cards. And Lynn, you've been part of it. Now tell me, Juville, I know, has participated over the years, but could you share what Juville has participated in providing services to the community? And could you just share a couple of the participating organizations for this year? I'm going to ask Dior to share some of the organizations also that are participating this year.
Sure, I'd be glad to. So here at Juville, we have 8 health profession programs. And over the years, we have tried to provide experiential service opportunities for our students, as well as us, the licensed health professional faculty, coming out to some of these health events. And we've brought pharmacy students to help with drug management and reconciliation of medications, blood pressure screenings, falls prevention, balance testing. And so at Juville, we are committed to service. It is our heritage to serve the community. So I try and make every effort to engage both our faculty, health professional faculty, and students to provide those kind of screenings out in the community. And I know I'm excited that on this event happening on December 1st, we have UB Dental coming to do free screenings, Erie County Department of Health Cancer Services, where people can come away with a colorectal screening kit. Certainly Catholic Health will be there, likely doing blood pressure screenings and some other services. Kaleida Health, the High Point Long-Term Care for jobs, ECMC, Univera will be there for insurance, the Great Lakes Cancer Care Collaborative for cancer screening, obviously the Osborne Association, Hospice Buffalo, the Urban League Project Hope, which is supporting behavioral health, and then UB Family Medicine and Elderwood Insurance. So lots of good information coming, as well as an opportunity to come away with a colorectal screening kit and have a free dental screening. So lots of good things.
Yeah, thank you. And I know you're a licensed social worker, and I know we have Buffalo Urban League coming with if you could let us know, why is it important to have someone there to talk about behavioral health?
Oh, it's absolutely essential for for us to have opportunities for resources and education around mental health, because once again there is a stigma that exists for what it means to focus on your mental health, get resources for your mental health, whether or not that's therapy, counseling, and additional support. But that education and that opportunity to be able to talk to someone, to be able to learn more about it. We're in the season of fall and winter, and seasonal affective disorder, for example, is something that a lot of folks may even be struggling with and may not be aware of it. So it's so important just to have opportunities for education and resources, so that we're better able to take care of our overall health and wellness. And you can't have good overall physical health without checking on your mental health as well. So it's absolutely essential.
Well, something I have to ask you, what is the seasonal thing you just mentioned that affects people during the fall and winter months? What is it? And what is it called again? You said it real fast, but I didn't even know what that was.
Oh, seasonal affective disorder?
Yeah, what is that?
Oh, yeah. So seasonal affective disorder it's a mood disorder. And it just occurs at the same time every year. Sometimes it could happen simply just due to, the weather and the season. For instance, during winter, we have less sunlight. In those periods of time, folks can find themselves feeling more down, feeling a little more sad or melancholy, flat affect. You might feel really sluggish. So just in that sense, just recognizing like even how the seasons can affect our overall mood and health. That's just one example that folks often do struggle with and didn't or may not even realize that it's a really common thing that affects us, especially being in Buffalo. We're known for our weather.
Right. I remember. Yeah, no, that's true. I remember when my sister had moved back from New Jersey, she said, I forgot how dark it is in Buffalo.
Mm-hmm.
Yeah.
It affects how we sleep, and it can disrupt, our internal clock. So it's so important just to be aware of that and how it affects our overall mood and mental health. So yeah, stuff like that is so important to, recognize and get information about, so that we know how to adjust and see what else we can do about it.
Well, thank you. And you know what? I don't think we mentioned, when you complete the Passport to Wellness, we have gift cards. We have gift cards to Tops Market. So I don't know, did we mention the gift cards to Tops Market, which are the incentive for going around and having the brief conversation?
Fran, I did mention it when I was explaining why it's a Passport to Wellness, and had mentioned it, but it's worth restating for sure that if they come on December 1st and dutifully complete the passport by going around and learning all the information as well as participating in the screenings, then they return to you, show their stamped passport, and come away with a gift card. I'm not sure of the amount, Francesca. I don't want to misspeak, but it absolutely is a gift card to Top Supermarket.
Yes. And what's it like to have a conversation? And Lynn's mentioned it. I think we've all mentioned it. But when we talk about a conversation, because I'm on the end, that basically I just ask, I'm asking you, what did you recall? What is a conversation? What's a typical conversation? And I'm going to ask you the same question. Then, what's a typical conversation that you engage the public in?
Yes. Well, certainly, the start of the conversation is just trying to make sure that I'm listening carefully to them. I explain, for example, if I'm testing their balance or falls prevention, why, or taking their blood pressure. But what I love about this event is that the people that do come are so appreciative and want to also, it's a social event, right? It's an opportunity to have a social conversation. But as I said, when I do the blood pressure screenings or the falls prevention, if I can just give them a few tips, a few recommendations, and I see their eyes light up that they get it or they understand, that is just very satisfying for me and great for them.
What's the most common tip that you would provide? So, like, we have listeners who are probably saying, I can't make it, but give me a tip so I don't fall or feel like I'm going to fall over.
Right. So, well, yeah. So the tips to prevent falls are, number one, in the home, to be sure that you have adequate lighting and that you pick up clutter and throw rugs and tripping hazards is the most essential thing. And when you get up at night, and many of us do, that take the time to turn on a light and don't say you know the way to the bathroom. Turn on that light.
Yeah. And it doesn't take long, folks. I have to say, listeners, it doesn't take long just to throw something out. You get a bag, you've been shopping. Let's say you've been in one of the stores or a thrift shop, get a bag, you've taken your merchandise out, just throw it out. Because I know some of us like to leave the bag on the ground. It's called clutter. And you'd want to just fold it up neatly, or fold it up, store it, or just fold it up and put it out away. Because not only is it you who may trip over something, if you have a visitor in the house, you don't want them, you don't want your children, your grandchildren, you don't want anybody tripping over anything in your house. So that's great information. Dior, what's the typical information that you share with one of the participants during Passport to Wellness, which this year is December 8th at the Broadway Market, 998 Broadway, beginning at 8:45 till 12:30, or till the gift cards from Tops Market run out. What's one of the number one things that you share, information that you share with participants?
Yeah, Francesca, sure. Sorry, Dior.
Yes.
Just Fran, before we move on, I think you just said December 8, and that is not correct.
Oh,
it is December
sorry.
1, the 1st of December at 8:45. Yeah, it's 8:45, but December 1st. Okay.
Thank you. Thank you.
Yeah, we definitely don't want to be a week off or a day off for sure. So a typical conversation, I would say, that I've had at Passport to Wellness, I want to say it varies somewhere between, thank goodness I don't need that. I don't have any loved ones incarcerated, but I have a lot of friends and family that could absolutely use your resources. So I'm going to take all of these flyers, make sure I put it in my community center, make sure I'm sharing it at my church. Because folks don't know that this is a thing. Folks don't know that you're a resource locally, because you're, new to the area. I would say another conversation that I often have, like I said, is where was this around when I was a kid? And a lot of people don't like to talk about, once again, that piece about how a loved one's incarceration can destabilize a family or can significantly affect them. So it's really just a cool opportunity to be able to engage with our local folks in their communities, to raise awareness, And yeah, it's definitely an opportunity for really cool relationship building. I've met so many great folks every single year that I've done it. So I'm super excited about this year as well.
Oh, great. Do either of you ever have participants who want you to come and speak at to their church, their school, or speak wherever? Do you ever get additional? Okay.
Mm-hmm.
Okay. Through the network.
Mm-hmm. Mm-hmm.
How about you, Lynn? Do you ever get people who are participants who are interested in learning more about Juville College?
Yes, well, and certainly, yes. And the one thing I did forget to mention is certainly here in the city and particularly on the west side, but it's certainly from the Broadway market. But I have the opportunity to share with them about our newest building, the Health Professions Hub, which does have through Catholic Health, a primary clinic on the first floor, but we offer physical therapy, occupational therapy on a sliding scale from zero pay to insured paid. But we know so many folks that don't have insurance or are medically underinsured for things that are important, like rehabilitation services. Our Health Profession Hub, again, committed to service here, would not turn anyone away who needed rehabilitation care. So that's one thing that I share. And then, yes, occasionally, especially when we work, as you know, with the Buffalo Municipal Housing Authority, I certainly get approached about coming back to do a broader, educational falls prevention or, blood pressure screenings and such. Yeah.
Or the pharmacy where you bring,
or the pharmacy for the medical management, medication management.
Right. Mm-hmm. And I just want to mention that Catholic Health, who they're a member of the Near East and West Side Task Force, through our board member Yvonne Askew, Catholic Health will be doing bone density screening. And that's where you take off I don't even know the details, but I know you have to take off your sock for them to do the bone density screening. So as you see, we have lots of different wellness services. We'll have someone there from Kaleida with information on jobs and careers at Kaleida. So we just have a variety of health and education organizations that are also members of the Near East and West Side Task Force and who provide this service. Anything you want to add that I haven't asked Dior or Lynn?
No, I don't think so, Fran. All I can say is to please encourage everyone to consider stopping down. Come early at 8:45. Get in the queue for your passport on December 1st, and know that everyone who is there is just hoping to help you be the wellest person you can be, the most healthy and the most supported, both with physical health, mental health, and social services.
Oh, and I know I'm going to ask you, Lynn, one real quick question. How long does it take to visit? Or Dior, how long does it take to visit with all these different wellness, health, and education and wellness vendors for that person who's in a hurry?
I would suggest that they could probably get through it in 20 minutes or so. Mm-hmm.
Mm-hmm. Yeah, I would agree with that. Mm-hmm. Yeah, but sometimes, folks might be in a rush and they might end up finding an exact resource that they didn't even know, might have been applicable for them. So I've definitely had some really awesome conversation with some folks, but on average, I'd say to really get a good amount, 20 minutes probably at the max. Mm-hmm.
Mm-hmm. Yeah, and as Dior said, it really depends, but you have to speak with everyone who's there. Sometimes our organizations may not, for some reason, able to participate. However, you do have to show that you've had a brief conversation, not a long, but a brief conversation in order to get the gift card. Is there an age? Well, not really, because I would say at age 15, maybe 13, because if you have children, if you're a 12-year-old with a child, 13-year-old with a child, we want you to come through, have that conversation, because a lot of what we have here could pertain to you. And again, it's a gift card for groceries at the holiday season. And that's why another reason we do it more, we do this at the holiday season. And I have to thank the Broadway Market, because if it weren't for the Broadway Market, we could be having this conversation, but it wouldn't be about Passport to Wellness on December 1st at 999 Broadway at the Broadway Market, across from the meat section. Just two more questions. Each of you ladies, are you going to wear something festive?
Oh, absolutely.
Absolutely. I wear a holiday sweater every year.
Okay. All right. So listeners, when you come in, we're near the meat section, and look for individuals standing around, standing behind a table, because you'll be in front of the table, who are dressed in holiday attire. And I think that is it. We are all out of time. One word to describe Passport to Wellness, starting with Lynn. What's your one word?
Fun.
Fun. Okay. Dior, what's your one word that describes Passport to Wellness?
Well, since Lynn said fun, I'll say educational.
Educational. Thank you. Well, I want to thank our guest today. That's Dr. Lynn Rivers, chair of the Physical Therapy Department of Juville College, also a board member of the Near East and West Side Task Force, and Dior Lindsay, program director for the Osborne Association, also a board member of the Near East and West Side Task Force. Did I say it right, Lynn?
Yes.
Dior?
Yeah,
Okay.
I'm the program coordinator for Buffalo.
Yes. Program coordinator, not program director, program coordinator for Buffalo. So, ladies, I wanted to thank you both for taking time from your busy schedule and being part of our Great Lakes Health radio program. And listeners, next week you will hear from my esteemed colleague from ECMC, that's Cindy Bass. And God be willing, in 2 weeks, you'll hear from me again, beginning from 7 till 8 p.m. We have 2 programs. And I'm Francesca Messiah from Kaleida Health, Manager of Workforce Development and Executive Director for about 13 years of the Near East and West Side Task Force. Take care. Bye-bye. And I want to say, listeners, don't touch that dial. We still have another half hour where we'll be hearing from the Near East and West Side Task Force on Passport to Wellness, taking place at the Broadway Market on December 1st, beginning at 9:30 in the morning. So thank you, Dr. Hahn, and thank you, Nicole.